My name is Ewa Jankowska. I'm Polish and I work in Wroclaw Military Hospital and also Wroclaw Medical University. For several years, together with Professor Ponikowski, we have been involved in research and clinical trials on iron supplementation in patients with heart failure. Therefore, I have come here to share with all of you our experience in this field. Iron deficiency is very common in patients with heart failure. We thought at the beginning that iron deficiency is just the cause of anemia in this group of patients. However, later we discovered that iron deficiency itself is even much more common than anemia, and that iron deficiency beyond abnormal hemoglobin level is related with poor exercise capacity and increased mortality in patients with heart failure. Therefore, at later stage, we came to the idea to supplement iron in patients with heart failure. As we know that iron deficiency has so significant negative effects on patients with heart failure, we decided to test if IV iron works in patients with heart failure. Until now, there have been several small clinical studies which assessed the effect of intravenous iron in patients with heart failure, but among these studies, two of them merit special attention. One is HF trial and another is HF trial. Both the studies have been performed with intravenous ferric carboxymaltose in patients who were iron deficient and patients who had heart failure with impaired systolic ejection fraction. Importantly, in the HF trial, it was shown that patients with heart failure benefit from IV iron regarding clinical symptoms and mainly quality of life, regardless of hemoglobin level. I mean, both anemic and not anemic patients benefit a lot from this kind of treatment. In HF trial, which was published just 2 years ago, it was shown that intravenous iron improves exercise capacity in patients with heart failure, increasing the 6-minute walking test distance. But what I think was extremely important to demonstrate in the study, as one of the secondary endpoints, it has been shown that intravenous iron can reduce the rate of heart failure hospitalizations in patients with heart failure, which we consider as very important clinical benefit. It's really important to emphasize that iron deficiency works not only in patients with anemia, but in patients who are not anemic. And why could iron work in these patients? Maybe because iron deficiency is needed for functioning of skeletal muscles. We have more and more evidence showing that iron is needed for the optimal energy metabolism of exercising skeletal muscles, of working myocardium. Therefore, we believe that we should supplement iron also in patients who have normal hemoglobin level but still remain iron deficient. It's really important to also realize that pathophysiology of iron deficiency is different from the pathophysiology of iron deficiency in patients with chronic kidney disease. Although many people think that iron deficiency in heart failure is due to augmented inflammation like in patients with chronic kidney disease, there is no evidence supporting this concept. We know that patients with heart failure who are iron deficient have very low ferritin, have extremely low hepcidin, and do not have increased pro-inflammatory molecules in the circulation. Therefore, iron deficiency in heart failure is an example of absolute iron deficiency, where in fact body iron stores are almost completely depleted in these patients. Therefore, there is really urgent need to supplement iron, and probably the intravenous route is the only one which could quickly and sufficiently supplement the depleted iron stores in these patients.